Hi. Hello, everyone. I'm Ruth McCambridge, and I'm the editor-in-chief of the Nonprofit Quarterly. And welcome to this special 90-minute broadcast session on nonprofit dashboards. This particular session is we had the most registrations that we've ever had for any session we've hosted to date. And we're actually not all that surprised, because not only is the topic incredibly important and useful to people, we have one ourselves and we know how useful it is, but we have an incredibly smart and insightful presenter to be able to really go through it with you and give you enough time to ask the questions that you need to ask about it. Before I introduce Hilda Polanco, I want to say a word or two about our sponsor, who has enabled you to attend this session free of charge. As you know, there are many webinars that are presented, and sometimes the quality reflects the price. That is not the case here. In fact, you have been you've been allowed to attend the most high-quality webinar by AccuFund, which is a nonprofit financial operations improvement specialist. Their financial reporting capabilities and intuitive dashboards enable sound decision-making and better strategic execution of your mission. Make sure that you do check out AccuFund. The fact that they're willing to bring you this kind of content reflects their high quality as well. A few housekeeping issues again before I introduce Hilda. We'll be taking questions. First of all, you will be able to get a recording of this session after we finish. Within about 24 hours, we will send you one. Additionally, throughout this presentation, we're going to be taking questions, and we'll be taking them after every individual dashboard model that Hilda covers this afternoon, and then again at the end. So make sure you get your questions in as they occur to you. So if we're looking over a particular dashboard, you don't understand why something is reflected in one way rather than another, ask that question then, and we'll get to it while the content is still right in front of us. Again, don't bother to ask us questions about resources during this session, because we will give you a slide at the very end, which Hilda will walk you through, the preferred resources that you should make use of. And so just, we're not going to answer questions about resources during this session. Again, also, we encourage you to tweet these proceedings to your networks of hard-working colleagues and friends, so they know about they know about this resource, the webinar, and use the hashtag Hilda on Finance, all one word. So with that, I want to welcome Hilda Polanco, who is the founder and CEO of a group called Fiscal Management Associates, or FMA. She's a well-known specialist in nonprofit finance, but I have a kind of a special screen that I use to to kind of nominate our favorite, at NPQ, our favorite presenters and writers on nonprofit finance. And that is the ability to really cut through the nonsense and make something as completely understandable as it can be, even when it's relatively complex. And to me, that's like, it's like a song. It's so beautiful. And so I want to welcome Hilda Polanco, who is going to be spending the next 90 minutes with us talking over the beautiful song that is Nonprofit Dashboards. Take it away, Hilda.
Thank you so much, Ruth, and thank you everyone for joining us today. It's really exciting to see the level of interest on a national level on this topic. And the concept of dashboards has become quite popular these days. If you just Google the word dashboard, the entries are just endless. And so we hope today that we will help you put this concept into perspective with respect to your own organizational planning. We live in a world where big data is overwhelming us. There were those days when we felt we didn't have access to data. In more recent times, the data is there, there's lots of it, and now the question becomes, what is the critical data that we need to look at, in what context, by whom, how often, and that's the goal for us today, to think about that, to think about how we use the idea of dashboards as a tool, as an element of management and of planning for the organization. We at FMA have really focused on this concept of operational excellence, and finance is a strong driver of operational excellence for an organization. But more broadly, when we think of operational excellence and what does it mean to really operate at that level, it's a culture. Operational excellence is an organizational culture, and that culture values learning, problem solving, idea generation, and a commitment to improvement. And so we want to put dashboards in the context of continuous improvement. It is not a one-time effort. It is not a black and white effort. It's an effort to understand where we'd like to go, what are our intended impacts in the sector, and how will we be getting there. And in that context, a key component of that is this concept called performance management. And just as you've heard dashboards many, many times over, you've also heard this concept of performance management, which is really being willing and having the discipline to ask yourself, how are we doing relative to our original plans? And are we meeting those targets? And more importantly, if we're not, how can we course correct? And so with that context in mind, I want to spend a little bit of time as we introduce this topic talking about the benefits of performance management. By engaging in this process, an organization can do a few things. And I want to stress the word engaging. The whole idea of performance management and dashboards as a tool is a very action-oriented process. It's a way by which you connect those plans that you have with the actual performance over time. So there's an alignment of what success looks like across the organization. Again, I want to stress as much as success. Part of the goal with performance management is that we're all thinking about things in a similar way, and we know what success, well, we hope we know what success will look like, and we want to know when we've gotten there. The process of performance management encourages dialogue. Think of this as a tool that you will use as the basis for conversation within your team. So again, it's not about the end result alone. It's how are we going to engage our leaders to talk about these things. And for some executive directors that I've spoken to, they think of the dashboards as a way to really celebrate. I think the transparency that comes with dashboard reporting, the clarity that it brings may sometimes create a bit of concern or hesitation, but it's not all potentially areas of improvement. It's a moment to celebrate the successes that the organization has when it achieves the goals that it is hoping for. The process will ground decision making in what we call concrete data, and I mentioned the overabundance of data in the past. I think you'll find as you try and put some of these steps into action that deciding what data we're going to track is probably one of the hardest points in the process, and understanding how that data is going to influence decision making. So that grounding of what is it that we're going to use to make these decisions as you think on an individual level and at an organizational level, it is bringing different aspects of the organization together. So these dashboards, these highlights of performance are going to help you connect some of the dots. So if we have this status in one aspect of the organization, we would expect a related outcome in another. And these reports and these dashboards allow you to test whether in fact that's the case, where things are things moving in the direction that we expect with the right levels influencing each other. So we're thinking about this from an alignment place, from a definition place, and we wanted to also share with you what we at FMA call the performance management cycle. So again, I want you to think about this as a journey, not as an end result. And this journey is about first understanding what will we be measuring? What are we going to identify as the indicators of success towards our intended impact? So finance, program development, all of these departments in support of what our goal is. Is it about impact with a particular client, a particular outcome? So we're going to define what those things are, what we mean to measure, and then in this discipline, we're going to be consistent in the data entry and interpretation. And that sometimes can be challenging. Which is the data? Where is it coming from? Who's responsible for it? And how can we consistently gather that data? Because over time, the quality and consistency of it will make a difference. So we've defined, we've started to implement, we're looking at these dashboards over time, and then we're going to use it as a way to monitor the results. And you'll hear me use the word trend over and over again. There's two aspects of performance management. One is over time. So how have results changed over time? This could be over a week, over a month, over a year. And then how does that compare to our initial goal? So the metrics are being measured historically as well as against plans, and sometimes both. So there's this element of defining the monitoring process and what we'll value as important and what we'll want to track. Once we've done this for some period, maybe a set of months or 1 year, give yourself some time. Think of it as an experiment. Give ourselves time to evaluate, is this working for us? Are we getting the information that we need? And what maybe isn't working? Maybe the gathering of the data isn't working as we expected. Maybe the way that we're sharing it. So think of this phase as an evaluation phase. And again, this idea that it's a cycle, if something isn't working and you've evaluated and you're realizing there needs to be a different perspective, then let's identify what those areas for improvement are and have a plan. And that's not only in the process itself, but in the execution. So if we have a certain goal for attendance of students in a particular part of our program, and that's not happening, refining isn't just about the process, but it's also about the steps we're taking to get to the intended outcome. And then we're back to refining and defining again. And so that life cycle of the performance management function, particularly in the early periods of implementation, I would encourage you to think of that as part of the implementation plan and think of from definition all the way to actually testing whether you're measuring the right thing. So there's going to be a timeline for implementation and a period of refinement. What makes an effective dashboard? We want to stay at a strategic level. Again, data is abundant, so this question of what are the critical points that will allow us to keep our dialogue at the strategic level that we are hoping for. And so with that idea, you want to focus on the right things at the right level. They're a tool to guide management performance. We want them to be as user-friendly as possible. I think as architects designing a building, sometimes we hear people say, oh, it would be nice to know this and it would be nice to know that. But I think the point here is that it's going to be crisp and it's going to be what we need in a way that folks can understand. So it will have a snapshot of where we are and where we've been, and how that story helps us understand what action steps we're going to need to take. It's going to help us measure against the target. So again, I mentioned earlier, over time, as well as against goals. The beauty of performance management is that you need to have a goal to begin with. So we need to know where we're headed, and then we can define targets against it. And we want to make sure that if there's anything out of the ordinary, any trends that are really either going off course from what we expected, and it may be good news or bad news, but that those are the levers we've identified. So it's not just about reporting historical information, but reporting the right information. And a critical term within dashboard development is this concept called key performance indicators, another buzzword of the day, and those are referred to as KPIs. And often KPIs come out of a strategic plan. In an ideal world, the strategies and goals that you set in your strategic plan have been translated into what really matters and what are those key performance indicators. Coming from organizational strategy, what matters to us, those will be the guidelines for these dashboards. And I want to stress the word manageable set. We don't want to have 150 KPIs. We want to have absolutely the right number, the least amount of KPIs that will give us the greatest amount of information for course correction and for reinforcement when we're doing things correctly. The whole point of the KPI is for planning and decision making. So we don't want to crowd our space with more information than we need. It's about the right information. So that performance cycle that I described from definition to refinement, within that, just making sure that those KPIs are the right ones and that you're calibrating them over time is an important part. And so in terms of what should we measure? How do we get to the right KPIs? There's a term that often is spoken about only in planning or in strategic plans, and I think one of the things that KPIs help us do is they help us think about what is our business model. As a nonprofit, we are all nonprofits and we all are in business to deliver against a mission, but the question of how do we do it, for some of us we are performance-based, for others we may have other drivers in our, particularly the revenue model. So understanding our business model is critical, and therefore developing the KPIs that support that will be critical. It will, again, KPIs will support our intended outcome, and they will guide priorities. And you've heard the term, what gets measured gets done. If the priorities are around a statistic of a certain type, that's where the focus will be for your leadership team. And so it's almost a self-fulfilling prophecy. If that's what we're measuring, that's what we're focusing on, and that's what will happen. And the key, again, limiting it to the right amount. And KPIs are not static. They're not with us forever. They should be reassessed. And so after a period of time, what we encourage, though, is to give yourself that amount of time to test and to see that you're heading in the right direction before you start to make changes, so that you can actually see over time whether in fact these are the right KPIs or not. So in terms of the role that the KPIs play in the business model, so once we understand what our strategic goals are, and I mentioned earlier this is really important to be connected to the strategic plan where you've had those goals. In understanding the business model, it's really important, I can't stress this enough, that an organization's plans reflect what are the sources of revenue, where are our risks in the revenue. I think when we think about risks in a business model, while there of course are risks of many types, the revenue risk, will the revenues come in as needed to deliver on mission, being a very big risk. So you'll see many KPIs will focus on sources of revenue and where we're meeting those targets. There could be and should be some KPIs around the expense structure. Certainly we think of budget to actual and forecasts as things we do to make sure we have a pulse on expenses. but it's more about the relationship between the expenses and the revenue and the program delivery. How are we delivering our program? What are the critical drivers that will indicate whether we will meet the goals that we've set out for ourselves? In many ways, performance management is risk management. It's a way of thinking about how will we have systems in place that will tell us if we are heading down a risky path. And I would say that the number one risk in a budget, whether it's multi-year or single year, is this idea of the revenue drivers in the business model. How reliable are they? How predictable are they? We're often spending dollars before they come in, and so we're betting on the fact that these dollars will arrive even if later than we've actually spent the costs associated. And so when we think of a business model and the revenue drivers, we have identified three, and others might think of others, but we think there's three critical elements in revenue that every business model can be fueled by, and those are the contributed revenue, the earned revenue, and we put government, even though some might think of it, depending on the type of contract, as an earned revenue, we put it in its own category because it's so special in so many ways. But in terms of the thinking of the risk associated with it, thinking of the things that we would like to keep our pulse with respect to the projections and the risks. On the contributed side, you can see that individuals, foundations, corporations, those are all the different types of revenues. And the question here is, how will our dashboards let us know if we're meeting those goals? And I would say that with the foundation and corporate contributions, one of the areas that we find to be very, very helpful is this concept of risk assignment or probability factors. So you'll see I have some examples of dashboards from a development department and what we should be looking at. But I think in the foundation and corporation world, thinking about revenue phases, are they committed, are they pending, are they to be raised, and how do we monitor that throughout the course of the year? Really critical part of this risk management on the revenue side. On the earned revenue side, you'll want to think about how is the earned revenue achieved. It could be fee for service. Other way of thinking about that is program fees. We may be selling things or services or products, but the variables there are around more of volume. How many of these will we build into our model, and price? What revenue will we bring in? So the model should tease out those contributing factors to the earned revenue. And then lastly, on the government side, with fee-for-service contracts, as well as performance contracts, the real issue here is around price versus cost. And so you'll see some of our dashboards that we've seen organizations build successfully are comparing those two. How are we doing cost-wise versus revenue-wise? And are we in the opportunity that we can actually have a profit, a surplus that we can use to support the organization? Are we reaching that? With reimbursement grants, it's a lot about cash flow and timing. So you can start to see how if you tease out what are the critical elements that we need to know around revenue, they will actually help you build what you would be tracking on the revenue side. As far as other aspects of the model, and what other key costs or other program delivery results might be considered. When we look at dashboards and KPIs and general categories where you may build them, on the cost side, there's certainly our number one investment is human capital. So you'll see many a statistic around turnover, cost of turnover, employee satisfaction, multi-year commitments. What are those categories of costs that we really need to be very, very careful about, and that will actually indicate performance? On the facilities side, you'll see performance measurement around reserves for replacement. So how do facilities really affect our ability to deliver on our mission? Do we have any long-term commitments that we need to keep an eye on over time? So again, which are those major drivers? And as far as delivery of program, you'll see that enrollment in earned revenue programs, enrollment, levels of client service, very, very important. Those drivers of volume will be critical to a KPI determination. And I have your process efficiency in that we only have a certain number of hours in a day. We only have a certain number of clients we can see at a point in time. And so if we can't raise more dollars to cover a smaller volume of work, the driver usually will turn to process efficiency. So how can we actually deliver the highest quality program while maximizing our available resources and being as efficient as we can? And so understanding what those drivers are in the process, which ones actually affect cost in the greatest way, that's all part of this planning process that we encourage organizations to go through before we jump into what exactly will we be measuring. And so we thought that as part of orienting you to this idea of performance management and this idea of what do I measure and when do I measure it, we would actually share with you some real-life examples of dashboards that we've seen over time, excerpts from dashboards that we think are good examples. There may be even better ones out there. Every format is unique to the management team that developed them, and in many ways they're representative of the model, the business model for the organization that they represent. So again, this is not one size fits all. This doesn't mean that this would be the KPIs that you would identify, even if you were exactly the kind of organization that we have in the example. But we hope that these will be thought-provoking for you and help you think through what might be important for you. And so as I go through a few of these, you'll start to see a few themes. And one is that there can be two different kinds of dashboards. There's a KPI set for the entire organization. So these dashboards would probably go to the management team, the board. They are organizational dashboards. Or we could have dashboards for particular departments, the development department, a particular program, a particular group of programs. And those dashboards typically would be reviewed maybe by the leaders of those departments, maybe by specific committees of the board. And at the board level, it's often a combination of organizational dashboard and maybe some specific priority areas. Again, there is no generally accepted accounting principle for dashboards. These are management tools, and you define them in your way in what will be most helpful to you in your management. For example, if we were looking at a financial package that goes to the board, the dashboard actually complements what's in the package. It does not replace the package, but we have seen really engage board members in a different way, engage board members in a way that's not about reading numbers on a page. So in this package where the dashboard kind of brings to life and graphs or charts what the results are, it is accompanying what we would, I just want to show you here the actual components of the package. The management narrative that actually tells the story and actually prioritizes in the eyes of the board what are the critical issues from the perspective of the executive director. I call it the CEO memo that accompanies the financial package and really emphasizes the priority areas and focuses, and oftentimes is focused on those key performance areas. These reports that I have here, the balance sheet, their budget to actual, year-end projections, which I believe are critical, an organization's ability to forecast where it will be by the end of the year, absolutely critical to invest energy in. We do a lot of variance analysis, budgets to actual, and I always describe that as justifying why the world didn't turn out to be the way you thought, or why things didn't follow what you thought they would follow. And that's important. We have to have an accountability and a sort of a fidelity to the original budget. But more important is, where are we going with this information that we now know? if reality has turned into a different direction, how are we going to manage the year end? So that's what we mean by year end projections, and extremely valuable, as well as the cash flow projections that go with it. These reports are generated, and they're called management reports, and they're generated all the time. The performance dashboard is going to be the ribbon around this that's going to highlight the very high level. For some people, they need words. For other people, they need numbers. And for those that really prefer pictures, the dashboard is very helpful. And we did do a previous webinar with Ruth here at NPQ, and there's a link here for you if you want to visit that original webinar where we actually went through this package and what we recommend with respect to these reports. But at that time we had said performance dashboard is really the wraparound to all of it, and today that's what we're focusing on. In terms of one particular example, let's start with our early education program. And as Ruth said, at the end of each of these examples, before we go on to the next example, I have about 3 or 4 examples, there's going to be time for you to ask any questions. So in the next few minutes, I'm going to bring it back to Ruth for any questions that she has received so far with respect to the framing or this early childhood education program. These questions could be around format, content, and we may not get to all the questions, but I'll get to as many as I can, and then we'll go on to the next example. So we're going to start with an early education organization. And the first thing, again, with this dashboard design is we want to think about which are the key drivers for the early education program. And so whenever you have a fee-for-service type model, enrollment levels are the key, and also the profitability of the programs given those enrollment levels. So if enrollment levels and profitability of program is what we're going to measure, we're going to do, in this case, 3 particular things. We're going to monitor the surplus or deficit of that particular program. We're going to track enrollment and attendance, and we're going to track the resulting revenue from these. And tracking revenue from program fees is a way of knowing, are we collecting the right amount because of the right enrollment, or do we have the enrollment but we're not collecting on the fees themselves? So we want to see the drivers that are going to give us those so that we can have action plans as we look at results. This is a picture of what an early childhood education dashboard could look like. This is, again, you want to keep as much as possible on one page and really look at how things relate to each other. Case, and again, if you were designing an early childhood education program dashboard, you might design different metrics. It depends on where the challenges have been. And again, I want to emphasize pride of authorship here. Each organization will look at different results. I think the key things I want to bring to your attention is one, in the first case, the year-to-date operating results. We want to look at actuals against budget and against the past. And so you can see right away when we compare this year's actuals to this year's budget, how are we doing against plan, and how are we doing against last year's actuals. So you can see here the trend not being very significant, but notably between those. With respect to revenue by service type, maybe the organization has a goal of a certain percentage going into nursery versus preschool. So this just gives you the concept of dollars and percentage of total. Some schools or some programs do have to deal with tuition and scholarships, so that was important to them. But I want to really focus on the bottom chart here. The bottom is addressing this idea of enrollment, and they have full-time participants and part-time participants. And just to be able to hone in a little bit more, I'm going to take a look at the part-time participants chart. I want to highlight a few things. This chart not only gives us the current enrollment for, the enrollment for last year, the budget for this year and what we are hoping to accomplish, where we are as of this point in time, and there's a reference to maximum capacity. And I think when it comes to enrollment and revenue drivers, this question of are we at maximum capacity, is an important one. We often speak to program directors who feel really challenged by the fact that they are asked or expected to budget at full capacity when in fact historically they've never reached full capacity. And so how realistic is that budget? This shows you where we're really pushing. So in the half day for the 4-year-olds, we're at maximum capacity in terms of budget. We're budgeting for that level, even though in the past we've only reached a certain level below. You can see that in the half days. And so in other areas, you can see that's the case with the 9-to-1, but you can see there are areas where we're budgeting under maximum capacity, but still at higher levels than the past. And so this gives a sense as to how we're planning relative to the past, and you can tell by the emphasis here that enrollment is really critical. We will never realize revenue if we don't have the individual children in the individual seats at the right pricing. So the conversation around here, around this dashboard, brings program into a very deep engagement around the financial outcome of enrollment, and it helps program staff understand the consequence of not reaching the goal relative to the revenue. So Ruth, I'm going to stop and take a couple minutes for any questions that you might have received so far relative to the design or relative to this early childhood education example. Do you have any questions you want to share with us?
Yeah, and you know, there were a lot of questions along the way that I think are more general, but I think can be related to this particular example that we have in front of us. So you and I talked about this before this session, Hilda, and somebody is asking the question about, you know, that this is an example that has to do with direct services, which is relatively measurable. And they're concerned about how applicable would it be to apply a dashboard measurement system to advocacy, say, or intermediary work, or the work of a think tank. So maybe just very quickly, I know that you and I talked about the need to just admit that in this particular session, although many of the concepts are similar, that this is really a more, it caters a little bit more to direct service. But do you want to talk at all about that?
Sure. Thank you. I think so. Advocacy it's really hard to measure units, but there may be particular activities that an organization enters into to bring its message to the world, and I'm using advocacy as an example. And so there may be drivers where there's legislation changes, or there are visits before critical people, or media hits, or articles issued on a particular topic, or number of interviews. And I know that there's this fine balance between outputs and outcomes. But you want to know that you're headed in the right direction, at least putting your best foot forward with activities that will ultimately impact policy. And so it's thinking through, the outcome may be harder to measure, but are we doing the right things? If we know that advocacy has the greatest outcome by doing these 3 things, and these are more activities, then let's think about what those activities are and make sure that the right people are doing the right things at the right time, in the hope that if we do that, we'll have the outcomes that we're hoping for. And that's how I would suggest shifting the thinking more to what are the levers, what can we do to affect policy and make sure that we're doing those things.
Right, and this is a related question, and it's on the harder side. So, somebody asked, do KPIs need to be numerical?
Well, they need to be measurable. Do KPIs need to be numerical? I would imagine that if it can be measured, it could be tracked. I'm having trouble thinking of a non-numerical KPI. It could be assessing levels of satisfaction. That's still numerical in that you're looking at the levels and quantifying how many of each. But I would say it needs to be measurable. So as long as there's a way to measure goal and outcome, I'm having trouble thinking of any way other than a numerical count of whatever it is that your goal is.
You know, some of this, one of the things that Hilda and I talked about before this session was the fact that we needed to look at dashboards for organizations that were not specifically direct service. So all of these questions that you're asking us, we're going to log them in and get them answered. Right, Hilda?
Yes. Yes, Ruth. Okay, we could probably take one more question before we go on to the next example.
Okay, this is a good one. Who should lead in the development of dashboards? And this asks board or staff, but I think more generally, who do you see leading in the development of dashboards?
I would say it's a joint effort. And so what I've seen work really well is ask both what is important. So we have a strategic plan or some type of strategic direction. I would start by asking the board, well, what's important to you in your role as the governing body of this organization and with these goals, what do you feel would be important? And you have a facilitated conversation there. And then again, we're all following the same strategy, board and staff. On the staff level, there would be a conversation of what's important. If our goal is to achieve this impact, how will we know when we've gotten there? What are the steps along the way? And then I recommend a meeting of the minds of the two. There needs to be engagement of folks in the design, and the board needs to feel like they're seeing what's important to them, and same for the staff. And when you do that sort of separate and then together, all with the same guiding strategy, sometimes the board might say, oh, well, actually, that's a really good point, and the same for the staff. And so you want to build a common vision between all of the leaders, both staff and board. Obviously, the process will be led by the staff in terms of the meetings and the conclusions, but the board needs to be in the design stage as opposed to saying to the board, this is what we think we want to measure. We want their input as well. So I'm going to jump to my next example, and maybe we'll have additional questions that will come up from that one. Another type of direct service provider, in this case it's a community health organization, and in the community health world, operational efficiency is a very important point. So again, I made reference to limited capacity with space. There needs to be a patient and physician relationship, and it's a factor of time. And so we want to make sure that we're operating in the most efficient way. There's also an element of facilities. So if you run, whether it's a health clinic or any type of organization that requires capital, you want to keep your eye on whether you have the reserves you need, the cash flow, the debt level that may be required in order to carry the facilities. We want to look at the efficiency of the revenue cycle, again going back to the operational side, and perhaps the cost per patient. In this particular case, there are 3 categories. So again, from a framing perspective, this organization has decided that revenue cycle optimization, operating results, particularly around gross margin and business line analysis, and then lastly, access to capital. Those are the 3 areas that they focused on. You can see it's different from the attendance statistics from the community, from the early childhood. And in this particular case, I'll just mention with respect to capital, anyone who's ever attended any of our webinars have heard us talk about months of liquid unrestricted net assets, and we call it LUNA. And it's this idea of what's our liquidity and what's our goal. In this particular case, their goal is to have 3 months of liquid unrestricted resources, and they're working on it, but they're not quite there. So you can tell right away there's a goal and we're not there yet. and what will it take to get there. There's references here on cash flow and debt. In the middle section, there's operating results and the operating margin. Again, you see the value of goal versus actual. You can see in the early quarters they were under the goal, and in the later quarters they've exceeded the goal. So the operating margin is a really good indicator. Very quickly, as well as the average cost per visit, there's a goal, and in this particular case you can see that some of those costs are exceeding. But again, in terms of zooming in, I wanted to take a look at this part of this dashboard, which is this idea of what typically will show up in a financial report is on the right-hand side. The days in accounts receivable, often referred to as accounts receivable aging. That is a typical chart that you would see in a financial dashboard or in an accounting report that would accompany the balance sheet. Here we have two indicators on the left side that are sort of indicative of what's behind the scenes to create the aging of the receivable. So for them, the processing time of the claims is really important, because the sooner they can process the claim, the sooner this claim can be turned into cash, and cash of course means liquidity. So there's a goal of the actual days to process the claim of 2 days, and you can see as of this time they're taking longer, and so right away there's an indication something's happening in the last quarter where the process time is taking longer. Now, interestingly, it's not about processing and getting it out the door as quickly as possible. It's processing and getting it out the door and getting it right. So looking at process of time to process together with denial rates, and then the result impact on receivables, you can see that they're taking longer to process, but the denial rate is lower, and therefore the accounts receivable aging is shorter. So you can see that there are interrelated metrics here, which is what I had in mind when I said earlier, understanding the interrelationships between different aspects of the organization. If you put this before the program leadership in this clinic, we can now just talk about what are we going to do differently. Obviously, we're doing something right in the denial and the reduced denials. What did we change? What can we do better? And that's the beauty. Now we're talking about what are we doing based on the data that we're getting at this particular time. So Ruth, any questions on this particular aspect of the dashboard, more around the process or anything else with the community health clinic?
Yeah, I think, community health clinics are of course very sensitive to aging of accounts receivable and that kind of thing. Why would, and this gets to the real distinctness of various business models. Can you talk a little bit about why this kind of organization would be so sensitive to both efficiency on the one hand, and on the other hand, the availability of capital?
So for this particular business model is about obviously high quality patient care. On the financial side, it's about getting the cash to come in the door as quickly as possible to fund the operations. These clinics are heavy facility intensive, so availability of liquidity is critical, carrying the payroll and carrying the operating costs. As soon as the mechanism for billing starts to slow down, the liquidity comes to a halt. So it's not like in a foundation-funded organization where there's a $100,000 grant that comes in at the beginning of the year and we're set. This is a process that has to always be refined and always focusing on maintaining patient quality of service with this sort of the engine that drives the cash. And I think that goes back to understanding the revenue flow and how dollars come in and what could go wrong and how would the business model fall apart if we weren't as efficient as we would be. So that's why efficiency becomes an issue here and in any case where you have to perform in order to collect, and the efficiency of performance is connected to that. It's a direct relationship mostly in the fee-for-service world.
Mm-hmm. So just, again, to look at this particular model of organization, obviously a number of people have questioned, how would you use dashboards to really focus in on mission outcomes? And can you talk about some potential ways that a community health clinic could track its mission-oriented outcomes in a dashboard?
So there may be a particular level on the program side. So if they've identified a particular challenge for patients around diabetes or around a particular health diagnosis, and they are attempting to improve the condition of the patients by doing certain treatments. So they might actually be able to track results, change in diagnosis or improvements in patient care. They might think about, certainly from a patient improvement of care overall or improvement of engagement with the patients. There may be some qualitative measures around client engagement in their own medical plans. And so it is more around, if our goal is decreasing this diagnosis or this particular condition, what are our goals? What are the things we want to test to see if they're working, and then see if in fact they are or aren't, and then address that. So that would be defining the medical results that we're looking for in the particular in the clinic.
Taking it one step out, I've worked with a number of health centers, and one I remember was in a community where the maternal health statistics were absolutely horrible, and the infant mortality statistics were bad. And they began to measure the outcomes in the entire community. And I think that your point about experimentation, the degree to which you can see, having tried this strategy, we see that it does nothing or it does a lot. How that really begins to address your ability to fulfill the mission. And dashboards are a beautiful tool to be able to do that kind of thing. They really do organize the conversation at the governance level.
And that's a great point. You bring up the sort of compared to the world at large or compared to peers. In these examples, we didn't highlight any peer benchmarking, but benchmarking to the community at large, and are we in a better place than the community? That means hopefully we're doing something different to make a difference. But also particularly around business elements compared to peers, if peer benchmarking is possible. And I think something that we've seen more and more, whether it's health clinics or any type of human service providers, being part of a network of some sort of similar type organizations where people are willing to share their KPI statistics so that then we can share some peer data. That's something we've seen in some communities that has been very helpful, just to, again, benchmark against similar organizations. Okay, great. Thank you, Ruth. I have another example. This is in home ownership, and for them, this organization was addressing this question of self-sufficiency for each of the business lines, and they knew that funding from the government was going to be phasing out over the next few years, and they were trying to figure out how do we get to self-sufficiency? How are our business lines covering their costs or not? Where are we profitable? How much is it costing us to serve a particular customer or user of the data? And these dashboards focused on what was their number one priority, which was profitability by business line. And we chose to share this collection of perspectives because you can see the value of using a dashboard on to see year-to-date information, to see the target profitability. So again, back to the goal, revenues and expenses by month. How is this comparing over time for each of the business lines? So there, this dashboard had many more business lines listed. Then there was this question of cost per customer, and so if we're going to be able to be self-sufficient, that means we're going to be able to generate enough revenue from the way that we're charging for our services, that we're going to be able to cover costs. So any organization whose business model relies on the ability to earn enough dollars to cover the costs associated with running the organization, you're going to see focusing on costs. And on the bottom right-hand side, we also here are introducing the element of sometimes there's lots of detail that gets rolled up into a summary. And while summary data over time is really important or against goals, the devil's in the details. And sometimes charts will actually give you a deeper perspective on why is this business line doing better or worse? What's been the trend over time, and how are the individual components of it changing? So this chart over on the right gives you a 3-year look, whereas the trend lines in the other charts are just for 1 year, 1 month at a time. So there's 3 charts where you're zooming in month by month the trends, and then there's this idea of over the past few years, what's been the average cost per customer, and trying to see what have been the trends over time. And something that would be a beautiful addition to the chart on the bottom right-hand corner would be what would be the goals for 2016, so that you can start to shape what will we do towards those goals. Just to, again, zoom in on the lending profitability chart, you can see that if you were a leader here, you might have this for 2015, and then you might be able to compare in 2016 how the trends are similar or different against this sort of year-to-date information that we're looking at. Again, what defines the success of this business line? Is it meeting or exceeding the goals? If our success is exceeding, then are we meeting that? That was what this organization had in mind when they actually developed these. Any questions on these, Ruth? I have one more, which is a performing arts organization, and then I will have completed the examples of the large organizational dashboards.
Well, these kinds of dashboards, which is, do you think that these kind of comparative dashboards give people, what are the levels of understanding that they can provide when you do a multiple year dashboard? Like what is it that you can imagine this kind of organization wanting to look at from year to year as variables?
So for this particular organization, cost per customer being such a critical component, they would certainly want to see the cost factors, and then even to go more deeply, what are the major components of cost, and then seeing how those components have changed over time. If the goal is to become more efficient, maybe it's increasing the volume of clients relative to the cost. It's also about managing the cost itself. So I think you would want to say, well, what are the critical components? What's been the history? And what do I think caused these numbers to go up or down year to year? What is my goal for next year? And then what will be the steps that I will take to ensure that? And on a lot of the earned income examples, it's just as much around efficiency. How many customers can you see, or how many customers can you service? So it's understanding what are the levers that are going to generate the goal that we're looking for, and then looking at that historically and into the future.
Okay, and again, these are supposed to be a strategic tool in organizing a conversation. We've gotten a number of questions about how often should people be changing the focus of the measurement?
I think that's a great question relative to this point that I made earlier about refining and being willing to admit that maybe these are not the right levers. I think at least, so we have annual plans. I think this dashboard, if we put it in the context of strategy, we hopefully our strategy is clear for at least a 2-year period. And then we might change our strategy. So as long as the dashboard measurements are following the strategic cycle of planning, I think that's a good way to think about it. But especially in the early part, I spoke to an executive director recently who said they're in their 8th year. And he feels like on the one hand they've got it down, what they want to measure, and they're all around the table and understand it, but maybe it's time to rethink it. And maybe we need to look deeper. So I think it's like you want to walk before you can run. Feel comfortable, maybe a year of the managing, looking at the results. Are we really not taking any action differently because we have this dashboard? Maybe that's not as valuable and maybe there's something new. But it's something I would say give yourself some time before you actually make those changes. And I'm saying 6 months to a year of actually going through it.
Yeah. Okay.
Okay, so performing arts. Don't know if we have any with us today. Um, Performing arts are interesting. They're like, in many ways, they're like childcare centers. We have seats and we have tickets, and we want to make sure that we're maximizing the revenue potential of this seating, which turns into dollars for the organization. We also have, in the case of the example that I have here, not only do they have the actual performance side of the organization, but they also have a school, and the school is intertwined with the dance company, but the school has this idea of as much as we want the same customers to come back for the performing arts part of the organization, we certainly want to retain our students at the academy. So there's some questions about retention, and we wanted to share this this type of dashboard. You'll see it's different from the other ones that we've covered. This one is less about history and more about goals. And we've actually found these types of dashboards to be very, very easy to maintain, which is a critical aspect. We want to make sure that these are not impossible to keep track of with respect to the software. But the easiest dashboards sometimes are the hardest to really be meaningful. So in this case, we're looking at the months of liquid unrestricted net assets, or down at the bottom we're looking at academy retention or summer workshop enrollments. So you see there's a combination of finance and program. And the first thing you want to ask yourself is what are the goals, right? So what would success look like? And that's often easy. Well, success would look like if we had greater than 5% in the case of operating results, or in the case of program performance, if we had percentage of performance weeks with shows greater than 20% would be great. What will be yellow and what will be red is where performance management really becomes a philosophy for the organization. So how will we determine that we're way off course or that we're within range but not there, not yet exactly? And so in the case of the program performance, greater than 315 meets the target. Less than 315 don't. So there we only have 2. But if you look at the retention rate, the last lever there, greater than 95% would get a green. It meets the standard. Less than 85, we're off target, and then that 85 to 95 is within range. So defining what's within range, what's close enough to not go on a red alert, that's where you engage your board, you engage your management. It's wonderful when you ask the staff, the leaders of these areas, to determine success themselves. What do they want to be held accountable to? What will celebration look like? And that discussion, building that, builds accountability in a really engaged way. And then whether something is red, yellow, or green is really a very simple process, but coming up with those targets is really where a common understanding of success really becomes valuable. So in this particular case, this is all we wanted to share about the performing arts, but we wanted you to see what it looks like when you're focusing very specific on performance for a period of time, and when you want to sound alarms. And in this particular case, if we had a board looking at this report, they would talk about performance and looking at enrollment, and because in other areas it doesn't look like it requires the attention that the red does. And that's why sometimes dashboards are equated with red, yellow, and green from a place of alarms or not. Any questions on this one, Ruth?
Yeah, why, again, in this particular case, you've got liquid unrestricted net assets as kind of, it's a real focal point, as efficiency was in the healthcare one. Can you talk about why that is so important in a performing arts organization?
Absolutely. So again, as with the health clinic, the performing arts organization doesn't have performances every day. And at times, the performing arts organization is accumulating costs for the performance, whether it's props or lighting or committing to space in advance of the events. So it requires a certain level of liquidity. Also, some performing arts organizations own their own buildings. So it's very important that for seasonality purposes, they have liquidity at their disposal and aren't in a crisis moment waiting for the performance, particularly if they don't have subscriptions that smooth the cash flow. So I think in any organization where there are peaks and valleys in cash flow, the liquidity of reserves becomes really critical so that they don't have to go for credit lines, or if they're not able to get credit lines, not be in a position where program might suffer as a result.
Yeah, and how do you feel about the visual of this particular dashboard? Do you think it works as well as the graphs?
I think what I like about this dashboard, and it, of course, if there was some accompanying historical perspective, that's always helpful as well, is that in a graph, it takes a couple minutes to sort of see the direction. It's clear if we're against goal, but to really see the trend, you study it a little bit. What I like about this dashboard is it helps you focus right away on where we have determined based on our success points we should be and we aren't. And so that red, obviously, if it's, hopefully the reds were once yellow and you were already thinking about them, and we're not looking at these issues for the first time when they're red. Yellow, there's still hope that we can turn things around before it becomes crisis. So I think it helps on the focus, particularly at the board level when you have this kind of layout, to really focus the conversation and the energy.
Right. You know what, it is very interesting. I do want to point out that the differences in these dashboards one to another really do have to do with a difference in the importance of particular variables from one business model to another. But they may also be just as sensitive to the mission intentions of one organization versus another. So it is, everything that you're measuring is at it's at the will of the organization. What does it consider to be important? And over what period of time does it want to find out if it really is important or is it not important, and that kind of thing. So it's really, it is a beautiful, I don't want to say tool, but it's a beautiful method for designing where your attention is to be gathered.
Absolutely, and that's why the engaging the stakeholders in that definition of success or risk that's part of the beauty of it. Those who are involved in designing their own metrics are going to be much more in line with them and committed than those who were assigned metrics and told this is what we're measuring and it's going to hit red if it hits this area, and call me when it does. So it's the engaging part that I think is critical.
Right.
As my final set of examples that I have here, these are focused on, of course, a favorite area of the organization when we're talking about performance, and that's fundraising. And fundraising is often referred to as development, but fundraising looks very different back to the business model, and what organizations track is very different depending on the revenue sources of the organization. In this particular organization, the organization provides literacy, youth, and advocacy services, and it's primarily funded by restricted foundation grants with some additional income from individuals. And for this particular organization, one of the things that they need to look at all the time is the gap in the to be raised amount. Their model is particular program delivery with a few very large foundation grants. They have a program design that they have that they believe in, that's integral to their strategy, but they're often facing, will the funders out there want to fund these things, or are we at risk of finding foundations that want us to do something slightly different from what we have in our plan? And then how do we measure that? And you'll see how that comes through. As far as individuals, of course, and board member giving, this is a subject of lots of discussion in terms of transparency and in terms of focus. Do we track board member giving? Do we send receivable reminders to board members if they haven't made their contribution yet? Do we give a board a list of the board members who have donated and those who haven't? It's a delicate topic, especially at a board meeting. And so in this particular fundraising analysis, there's a few things going on, and I'm going to focus on the fundraising raised by program secondly, so I'm just going to focus on the right-hand side. This example really speaks to the way that this organization thinks about its donor base, and they have particular categories of friends and supporters and builders. There's the number of gifts that are involved in each. But the important part I want to mention here is that this organization segregates funders by category, and there are goals and there are amounts raised to date. And this is one way to look at the comparison of both of those. So are we almost close? So friends, we seem to be pretty close to the $80,000 goal that we had. There's in some cases in the builder we're quite off there. So this is one way to measure that. In terms of board giving, there's a goal of $120,000 for this year. You can see it's significantly a little bit higher than it was last year and much higher than the year before. So if we're at 2016 year to date, another way might have been how did we expect that the board giving would happen over time. So it's having the courage to put board giving as a metric on the dashboard, and going back to having the board define success and identify what things they want to measure. For this organization, putting this on the dashboard means that the board has said this is important and we want to measure this. And so when we do exercises with groups around setting KPIs, and we give examples of what other organizations have considered measuring, we always put that out there to remind them that in fact this is something that many boards do track, and it helps encourage the board at hand to really put that out there and measure it. This particular chart has a lot going on in it, and this was created for an organization that they started the year, and here's where you could see the first dashboard where it's a combination of graphs, charts, colors, and numbers. They have a $2.1 million expense budget. They've raised 1.6 of it. So before the beginning of the year, before they actually started looking at the to-be raised amounts, they had a certain amount raised. They had raised $1.6 million. They had to raise another $500,000, and based on fully loaded costs by program, they knew where that $537 was needed. So this idea that the board knows how much they need to raise and for which program is a really important concept, whether it's a dashboard concept or a financial analysis concept. And then what they do is they watch their prospects very carefully all the time, and any prospect that has more than a 75% probability of coming in, and again, these are all management estimates, those probabilities, those grants are identified by program area so that the board can see with everything that we have out there in potential grants, we have the possibility right now of bringing in $2 million. And so compared to the 2.1 that we have in an expense budget, we still have to raise 152,000 to meet our expense goal. But what's interesting about this is that the analysis is telling us we've actually in some cases will have raised more than we need in youth and in legal and in management in general. Of course, that will be grouped with fundraising, so that's less of an issue. So we have some programs where we've raised more than we need, and in others we haven't raised enough. And that is going to require some action either on recalibrating program focus or thinking about what does that mean? Do we need to do additional activity of program? And you can see the colors. There are two programs, literacy and advocacy, where there needs to be additional funds raised. There are some programs where, again, in youth, you can see we will be at a higher level, about 600,000 compared to the costs that we've budgeted. So there, in the board conversation here, it is about, is something happening in the marketplace with these two program areas, and do we need to redirect our staff time? Because it is a small budget with a small organization, and the staff is fixed, and so the action plans start to sound like deploy our staff in a different way, re-challenge ourselves with whether this program has the funding that we thought it would. So this conversation is very specific to very restricted fundraising from foundations who have their own vision of what they will and won't fund. This type of chart crosses finance and development efforts, and we have found it to be a great way to unite finance and development under one conversation about what are we raising, what is it for, and how does that compare to what our goals are for the year, our original plan of where we needed to raise money so that we could deliver on the goals that we had programmatically. So this is our last example on fundraising and our last example of dashboards. Ruth, any questions come in either on the individual and board giving or this idea of restricted foundation giving?
There was a question on restricted and unrestricted giving. And maybe you can just in general discuss why that's such an important variable for some organizations.
Sure. So unrestricted giving obviously would be the best of all giving. It allows an organization to be free in its program design and do what it thinks it needs to do to achieve the outcomes that the mission calls for. Restricted funding is wonderful when it matches exactly the goals of the organization and when the grants, the expectation of the funder is consistently in line with that of the organization. I think what happens often is foundations are purchasing goods and services that are in line with their strategic priorities. And while of course they will select grantees whose work focuses in those priorities, we're really when we accept as a nonprofit a restricted grant, we're accepting delivering the outcomes that that foundation is expecting. And so in some ways it ties our hands a little bit, but in some cases, which in this particular organization it happens at times, if you have a budget, in this case of $1.6 million, that has particular line items in it. And the goal is to raise money for that budget to cover those activities. But if you raise a $100,000 grant towards that program, but actually that grant requires you to do something that was never contemplated in the original plan, oftentimes organizations will count that $100,000 towards the plan, but in fact only $80,000 of that is towards the plan, because this foundation wants $20,000 to go to a special year-end report or a special graduation or something that wasn't in our plan. And so we now need to deliver on that, and the restrictions aren't really what we needed to deliver on our original plan. So the understanding the restrictions, their implications, the ability to deliver without jeopardizing what we originally planned as an organization, I think is the biggest risk there.
Right. So I have one question which a lot of people have asked, which is, how the heck do you figure that you have an above 75% probability of any particular grant?
That is it's an art, right? So I often, when I do trainings and I talk about cost allocation plans, I write across the top, the art of accounting, and this is the art of fundraising. It's a feeling. It happens over time. The probability, I think the definition of what is 50%, 75%, some organizations are fairly formulaic with that. If we have a relationship, if we've had a grant before, if we know the person, if we've had 3 phone calls, it's understanding what's our basis for that. And then it's a risk tolerance, whether it's the development director or the executive director. It's a balance of risk without being too overly optimistic, particularly when these charts get translated into cash flow projections. When a development director understands the implications of saying that this grant should be counted in the month of October, and then he or she sees what that implication is to the bottom line, it sort of keeps it real. And so there is no black and white. It's different for every organization. The important part is that everyone understand the assumptions of how we made it 75 versus 50 versus something else. And that it be monitored. If things that are in the 75% probability never happen, and this happens over and over again, someone might say, well, I think you're being overly optimistic. But if the 75 probability most of the time do come through, then obviously this person or this group of people has a way of some consistent mechanism for doing it.
Yeah. And, you know, it very much depends on your circumstances. There have been times where I've been asked what's the probability when I had really not a clue. And it was very much about how new the organization was, and et cetera, et cetera. So the more track record, the better, obviously, to base things like that on. Now, I have just a couple more pieces. Are we done with your slides yet, or?
I'm done with the example. I just have a couple of sort of jump-starting the process, and then I'll be open for a few more questions. Okay. Absolutely. So just, again, this was a tour of different possibilities. I hope that the first 10 or 20 minutes of the presentation were more important than the second in your thinking. We want you to go into this with, okay, how do I begin tomorrow? And while the selection and the looks and charts and graphs or or tables is really critical. The process is what we want you to be able to jump into. So start with the big picture. Who's the audience? How are you going to engage them? How will you identify those models? How will you create a team-based process? Think team, collaboration, culture, data-driven decisions. What's the data? Where is it coming from? Who's going to be on that team? Who's going to be accountable for it? And when I say accountable, I mean the process. Someone will lead it, but the data points, who will be leading in those? How will it be updated? How can we make our staff feel more comfortable with the concept of data? And then lastly, and again, we're often asked the question, is there software out there to do this? And you can see that the best dashboards are a combination of finance and non-finance. And so I think it's hard to find the dashboard software that can accommodate that off the shelf. What we find is organizations begin with Excel, and then ultimately they are using packages that are tabulating data, pulling data from different sources to be able to get, again, to overcome the overabundance of data, to be able to get the critical information from various sources to come together. But don't worry about the software at the beginning, worry more about the first few steps. So those are my closing words of encouragement. And Ruth, I know we have just a couple more minutes. Any other questions that you have there?
Well, there are a couple, and I'm wondering, I think maybe instead of going to these couple of questions, I'd like to maybe chime in a few words. We, as the Nonprofit Quarterly, we have a dashboard of our own, and it's like a little miracle. But it is in constant motion. So when we find out that the dashboard results are raising questions which we don't have any way of measuring the variables on, we'll create something else to allow us to answer our own questions. So the use of a dashboard is not in having a totally static tool, although some elements of it may be. But in having something that really will allow you to pose a hypothesis, test your assumptions against reality over time, and then decide whether or not you want to change your strategy. And something that works now may not work for you later, as we have seen in things like the terrible situation that arts organizations were in during the recession. The variables around them really changed significantly, and so their dashboards also needed to change, and that for a while it was unclear exactly how. But again, I know I've said this a number of times, but the use of these dashboards is really to help organize a sophisticated conversation about the specifics of your operation. Would you agree with that, Hilda?
Absolutely, absolutely. And so I think the willingness to dig deeper and to say, we've looked at this, now what does this mean, is the essence of that. And the willingness to take risks and be vulnerable and share and strategize together, as opposed to sort of running away from the news that the dashboard might be bringing up at times, is the key.
Yeah, there's one other thing that I would say. We did get a couple of questions saying, can staff do this? How much knowledge do they have to be able to create these kinds of graphs? This is such a, when you get into it, it actually turns out not to be that difficult. It needs, it needs a kind of a visual sensibility in somebody organized, within the group, and it needs the ability to identify the questions that need to get answered and for what reason, and identify the mission-oriented questions, the financial questions, the questions of outputs, etc. And that's entirely within your control. There's nobody telling you you have to do it this way or that way. This is about the organization judging itself, which is the real beauty of the methodology, I think. Um,
Absolutely.
yeah, and then, once you've got this down and it is fully supportable, it's a tool that you can use with everybody from funders to constituents to, your staff and board. This does not need to be dry material at all. It can be the very exciting material in the middle of the organization that keeps everybody kind of organized into the same vision.
Absolutely, and there I've seen some organizations who publish their dashboards on their websites. Depends on how transparent and how much sharing you would like to do.
Right.
So I think, Ruth, we're near our end here. I just wanted to point to those folks who are with us and those who will receive the recorded that we do have some resources at the end of the PowerPoint. I encourage you to look at them. There's a set of articles that we've handpicked from how to get started to one particular example we thought, Hands-on Atlanta. It's an article from Bridgespan and a few others that from the how-to actual examples of successful uses of dashboards. There are ongoing tutorials for the website called strongnonprofits.org, which is a website that helps organizations really access some top-notch financial tools, including lots of articles on planning and dashboards. The resources for NPQ's prior webinars and to subscribe to the magazine, here are some links for you. And I will turn it back to Ruth. Thank you so much for joining us today, and I hope to hear lots of great success stories of those folks beginning the performance management process.
Yeah, we would love to have you stay in touch with us and share examples of the dashboards that you do develop. But we've also, out of this webinar, we've gotten a very clear sense of what the unanswered questions still are. And so we will be following up on this topic throughout this year. If you have any suggestions of pieces that you would like for us to take on in subsequent webinars, we welcome them from you. And with that, I'll say thank you so much, Hilda. This was wonderful. And to all of you that came today, thank you for spending this extended little period of time with us. And please give us feedback. Let us know what worked and what didn't. And